Hi, my name is Michelle Price, and I will be doing my presentation on should substance addiction be labeled a brain disease. I will be arguing the con side of this issue. So to start off, I'm first going to explain to you what addiction is. Addiction can be described through three different ways. It's defined as a loss of control of substance consumption, substance use despite associated problems, and the tendency to relapse. Like other diseases, addiction is a result of genetic, environmental, and developmental factors. So it's a whole bunch of factors combined into one. Genetics accounts for about half of a person's vulnerability to addiction. Um, and unique to drugs, a person must be exposed to drugs to become addicted. But exposure alone is not enough to become addicted to drugs. There's a lot of issue on defining addiction as brain disease, brain dysfunction, a choice. According to Dr. Nora Volkow at the National Institute on Drug Abuse, disagreements about the nature of addiction remain, namely whether it reflects voluntary or involuntary behavior, and whether it should be punished or treated as a health issue. Even though the first time a person takes a drug, it is often by choice to achieve a pleasurable sensation or desired emotional state, we now know from a large body of research that this ability to choose can be affected by drugs. So now I'm going to explain to you how addiction affects the body. It affects the body in general and the brain. Now, addictive substances are believed to all have psychomotor stimulant properties that cause positive reinforcement. This is the basis for psychological dependence and drug cravings that are not related to withdrawal. So this is, this makes me feel good, so I'm going to keep taking more. That's the positive reinforcement. Addictive substances are also believed to activate mechanisms that suppress pain and distress, causing a negative reinforcement. This contributes to habit forming and drug cravings. So I'm in a lot of pain, I need to take this drug, or this drug gets rid of my pain, I need to take the drug. That's the negative reinforcement. Now, addictive substances also affect the brain. Scientists have discovered that alcohol and drug abuse affect specific neurotransmitters in the brain. It depends on the drug, depending on what neurotransmitter is affected. However, it has now been established that even though they don't affect the brain in the same way, all substances that trigger dependency increase the release of dopamine. They all affect dopamine. And dopamine is the neurotransmitter that affects your motor control, your motivation, and your pleasure. And this uptake of dopamine is responsible for a phenomenon called incentive salience, which means when a person is presented with a stimulus that was previously associated with the addictive drug, the person experiences an overwhelming urge to use that drug. So say a previous heroin addict sees a syringe at a doctor's office. That's going to stimulate in their mind, give them the urge to take heroin again. Now, who does drug abuse affect exactly? Drug abuse affects everyone in our nation because it costs our nation more than $484 billion per year. They get this estimate from, this includes healthcare spending, lost earnings, and costs that are associated with either crime or accidents that are caused by substance misuse. The cost of drug abuse is just as high as other chronic conditions, such as diabetes and cancer. Diabetes costs society about $131.7 billion annually, and cancer costs about $171.6 billion annually. I found that information to be pretty shocking that substance addiction affects us affects our nation in a close way that cancer and diabetes and these chronic conditions do. But more specifically, who does drug abuse affect? It really greatly affects the family members of those that are addicted. Over a long period of time, these family members begin to feel intoxicated themselves, and they're intoxicated with emotions. They're called intoxicant emotions, and they can include guilt, shame, worry, or anger. And this can cause a person to feel depressed, be secretive, or run and hide from their problems. So it can affect and cause problems in other people besides just the person that is addicted. So the issue at hand, should drug addiction be labeled a brain disease? I am the con side, so I will say no, it should not be labeled a brain disease. There are three different reasons why I will explain why it shouldn't be labeled as a brain disease. 1 would be spontaneous recovery, 2 is the dopamine uptake, and 3 are brain scans. I'm going to go into these a little bit later. First, I'm going to give you a few quotes from people on why this should not be labeled a brain disease. Mark Lewis, a developmental neuroscientist and professor of developmental psychology at Radboud University in the Netherlands, describes the label of brain disease as it's accurate in some ways. It accounts for the neurobiology of addiction better than the choice model and other contenders. It explains the helplessness addicts feel. They're in the grip of a disease, and so they can't get better by themselves. It also helps alleviate guilt, shame, and blame, and it gets people on track to seek treatment. Moreover, addiction is indeed like a disease, and it's a good metaphor. And Dr. Levy of the Institute of Neuroscience and Mental Health says, the claim that addiction is a brain disease is almost universally accepted among scientists who work on addiction. However, the impairment that addiction causes in the brain is more accurately described as a neural dysfunction instead of a neural disease. So now I'm going to go a little bit more into these. The first one being spontaneous recovery. Labeling drug addiction as a disease does not account for spontaneous recovery, which means that many addicts can get better by themselves without medically prescribed treatment or even without going to a single Alcoholics Anonymous or Narcotics Anonymous meeting. They can just get better by themselves. Alcoholics recover naturally, as they call it, at a rate of 50 to 80%, which is more than half of alcoholics. So for these individuals, recovery is described as a developmental process. This can mean a change in their motivation to obtain the substance of choice, a change in their capacity to control their thoughts and feelings, and maybe a change in certain factors that get them to work harder at overcoming their addiction. This could be, like social factors or economic factors. They can't afford the drug addiction anymore. And unfortunately, though, for other medical diseases, people cannot just get better by working really hard at it. Medical diseases don't just go away by simply, trying really hard, which is unfortunate, and that's why this whole labeling it as a disease definition doesn't really fit in with the other medical diseases. So second will be the dopamine uptake. As I said before, dopamine is the neurotransmitter that affects your motor function, your pleasure, and your motivation. And so dopamine gets released and increased when people are on drugs. However, every single experience in your life that has emotional content changes the uptake of dopamine in your brain. So as Mark Lewis stated, there are certain different types of moments in your life that create this uptake in dopamine, yet we wouldn't want to call the excitement you get from the love of your life or your 5th visit to Paris a disease. Both of these things cause that increase in dopamine. They all almost act in the same way with these neurotransmitters that drugs do, which is really interesting. Each rewarding experience builds its own network of synapses that send a signal to your midbrain saying, I'm anticipating X, so send up some dopamine. That's the case with, romantic love or Paris and heroin. So your body is kind of saying, I'm going to Paris, so send me more dopamine. I'm going to take heroin, so send me more dopamine. It works in the same way. During and after each of these experiences, the network of synapses is strengthened, so the dopamine uptake is increased. So the way that this can be described is London just doesn't do it for you anymore. You need Paris. It has to be Paris. Or, with drugs, pot or wine, they don't do it for you anymore, but cocaine sure does. So these physical changes in the brain are its only way to learn, remember, and grow. This is how the brain learns and develops, but we wouldn't call learning a disease, which is again kind of why the definition of disease and the label of disease, it just doesn't really fit with addiction. So finally, I'm going to talk about brain scans. According to the cleanslate.org, in a true disease, some part of the body is in a state of abnormal physiological functioning, and this causes the undesirable symptoms. So like in cancer, it would be mutated cells, that is your abnormal functioning. In diabetes, it could be low insulin production. people with these diseases cannot just directly choose to stop these abnormal functions. They can only stop them indirectly through medical treatment. But in addiction, there is no physiological dysfunction or malfunction like that. The changes that we see in brain scans of substance abusers, they show no abnormal findings. They don't show anything like that. So the changes that we see are perfectly normal. There have been reports that scans can show brain changes specific to drug addicts. However, these changes are a result of different areas of the brain becoming more or less active depending on how much they are used. And that is just a continuous process throughout life, and that's a normal process. And that happens for everyone. It's not isolated to addicts. It happens in every human being. Non-addicted, non-depressed, people with no neural dysfunctions or diseases at all, they experience these changes too. So this kind of proves that the research done on that shows addicts with specific brain changes, this research is unreliable because everybody shows these changes in their brain scans, not just addicts. So what would be the possible solutions? Many hard activists, like these people at cleanslate.org, they really want substance addiction and abuse to be labeled a choice. They think it all has to do with a choice, and it's the person's decision whether or not to continue to take that drug. I think a better solution and another solution would be labeling substance addiction as a neural dysfunction instead of a neural disease, because it does still impair your judgment and it affects the brain and body in a way that makes the person addicted to want to continue to take more. It starts off as a choice, but eventually, your body tells you that you need more, and that's what causes you to need and want more. And what are basic solutions for addiction itself? According to addictionmanagement.com, there are 5 steps to recovering from addiction. The first step is deciding to change, and that's just recognizing you have a problem, deciding that you need to go get help. 2 is changing your addictive behavior, so that's actually, either quitting cold turkey or the slow process of weaning off the drug. 3rd is preventing relapse, so making sure that you do stay off that drug. 4th is resolving core issues. So this can go back to issues that maybe you had with yourself to begin with, and that's why you started taking drugs. And the 5th and final step is living optimally, and that just means living positively and having a positive life after your addiction. So, in your conclusion, addiction affects everyone in the nation regardless if we know someone who has a substance addiction or not. It costs our nation a lot of money and it affects all of us. Addiction should be labeled a brain dysfunction instead of a brain disease because the term disease does not account for spontaneous recovery. A dopamine uptake can happen in any exciting moment that we do, and these exciting moments are not defined as a disease. And addiction does not have a physiological abnormality like other diseases do. So the term disease just does not really fit with addiction. That is my presentation. I hope you liked it.